Dr. Jolly Thomson. I focus on clinically supported lifestyle correction for treating chronic lifestyle diseases. Here I would like to share my professional experience with this approach. This series is about my experience with patients who took clinically supported lifestyle correction to avoid surgery and reduce and stop medication. This can help you understand how valuable are the lifestyle corrections needed for overcoming any chronic lifestyle disease. Most importantly, what advantages such an approach has when deciding on surgical procedures or continuing with lifelong medication. Here we learn of the approach for a patient suffering from allergy, asthma, recurrent throat infection, hypertension, fatty liver, grade 2, gastrointestinal problems, especially anal fissures, varicose veins, etc. Here I will try to explain how this patient was able to reduce medicines and come out of diseases. How long it took to get relief from symptoms and progress evaluation based on corresponding improvements in periodic tests. Before starting the case study part, I would like to bring to your attention how the major part of the medication we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us human but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medication. To protect our children, grandchildren and the coming generations from the ill effects of the toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. When we come to the details of the patient, this is a lady. His height is 162 centimeters, weight is 67.4 kg, calendar age, that is her age is 53 and body age is 63. That means she's her accelerated aging and she can get any diseases which can be of the age of a 63-year-old lady, even though she is only 53. And her abdominal circumference is 90 centimeters. Fat percentage is 39.2%. Diagnosis comes, basically her major problem is allergy, asthma and recurrent throat infection and respiratory infection. That is actually troubling her. And she is on hypertension medicines for many years. And on the scanning, she is having fatty liver, grade 2 is there. Gastrointestinal problems, especially she is having anal fissures actually, and varicose veins also. So the disease category is basically allergy, metabolic disorder is there, hypertension is there, obesity is there, and also allergy, asthma is there, and also autoimmune disease is there. That is varicose vein and the anal problems, fissures and piles and all this comes under autoimmune disease. She is taking medication for hypertension, amlodipine she is taking, and also a syrup she is taking for this cough, that is Scoril syrup she is taking 10 ml twice a day, that contains ambroxol and levosalbutamol and guaifenesin, that is cough syrup actually, and inhaler also, and usually twice a day she needs, sometimes it is more, that is the pattern, it is taking for a long time. And when we check into the blood test, actually she's pre-diabetic, she's not diabetic but she's pre-diabetic, HbA1c is 5.9, insulin resistance is there, insulin is 26.3. Usually if there is no insulin resistance, usually for RBS blood sugar is 89, the insulin level should be around 4 or 5 only, but it is 26, that means insulin resistance is there. And the triglyceride and cholesterol are slightly elevated, it is not that much. And her ESR is very high, 107 is there. That is because She's having this autoimmune and allergic disorder. hsCRP is 14.6. There is actually a cardiac marker also that is high, and CRP is also high. That is maybe because of the infection also. And the blood count, other inflammatory parameters, blood count, WBC is high, neutrophil is high, lymphocytes also is high, and her liver enzyme SGOT is high. Albumin and liver function, it is also come under the liver function test. Albumin and protein also slightly on the higher side, and vitamin D level is low. And when we come to the discomforts, her discomfort is throat discomfort, cough, and chest discomfort. Dry cough, continuous dry cough, wheezing is also there. And leg pain, that is because of the varicose veins, there is pain. And also anal fissure and piles also. That is actually her symptoms. And when we come to the weight, she is 67.5, BMI 25.7, BP, in spite of taking medicine, 150/100 is the BP. Abdominal circumference 90 centimeters, body age is 63, 10 years plus, that is accelerated aging, and fat percentage 39.2 is there. When after we start the clinically supported lifestyle correction, it is because she is obese, we control the calorie to around 650 to 700 calories, but ensuring all the nutrients and minus these toxins, this color preservatives, tastemakers and all, to be about as much as possible reduce the such food additives. And special exercise pattern which can be done on a lying down position or sitting up position, and for the even the arthritis patients and all can do it. And the patient may have to spend till the weight reduction is achieved, they have to spend at least 2 hours a day, and if they spend more time, more faster result. And other food, the special food is provided, and the other food for a obese patient, minimize the other food, but they can have some leafy vegetables and non-veg food. There's no harm in taking, if they are non-vegetarians can take non-veg also. And for the vegetarians, some pulses and leafy vegetables is the ideal when you are reducing on weight. And one weekly once a cheat day is that day you can take whatever cravings food you can take. Only thing, the food which is intolerant to you or allergic to you, especially when you are an allergic, and to some food, or and also that is very important for the autoimmune disease patients and for the allergic diseases. This person also having many food which is allergic and intolerant food is there. I'm not describing all those things, but it is not important for the others, because it is each person, it is specific. So there are food you have to check it and by the test, and you have to avoid it also. Next, when we come to the result of when we analyze the result, she was taking medication for hypertension, but by the 8th day he was able to overcome from that, but with the normal BP. While she was on medication, her BP was high, 110, 150/100. But on the 8th day when she came at home, her BP was 120/80, 120/70 and all. But when at the hospital, she was showing a 130/90. But on the 15th day, it was 120/80, and after that, it was continuing. Even at the hospital, BP measurement is the same. And for medication, actually, that she was able to reduce that scoring, that medicine for the cough, 10 ml to 5 ml twice a day for the 8th day. And by 15th day, that cough syrup and the cough is completely disappeared. It's gone actually. And inhaler also, she is by 8th day she reduced once a day, and from the 15th day onwards she was not taking inhaler at all. So that breathing difficulty and the cough is over. And she was not diabetic, but the pre-diabetic, and it is 5.9. And by day 30 she came down to 5.7, because she was not diabetic. We are not 8th and 15th day we are not checking. And by day 30 it is come down to 5.7, and day 60 it is 5.5, and day 90 it is 5.4. She's overcome from the pre-diabetic stage is over. Insulin resistance, the initial insulin value was 26.3 and it came down to 9.6 by day 30. And triglyceride and lipid profile was come down to normal. And ESR was very high, and it is actually initially there was the 8th day it was slightly actually increasing at 107 to 109, then started reducing 91 on 15th day. Again, the ESR was slightly variation was coming down, but by day 90 it came down to 74. And HCRP and CRP, HCRP was come down to 14 to 4 point by 8th day and normalized by 2.4 and 15th day. CRP came down to normal by 8th day, and all the blood count came down to normal by 15th day. 8th day we usually don't check the CBC blood count and all because it takes some time to correct it. And liver function has come down to normal by day 30, and all the liver function came down to normal. And vitamin D was low and it was come down to normal by day 30 itself. Symptomatic relief, she relieved almost 60 to 80% relief. Throat discomfort was actually the most troubling, and that has come down to 60% and right up to 80%, wheezing 70%. And leg pain, there is no leg pain, and varicose vein symptoms and all is gone. Anal fissure also come down to around 60, and by 15th day she was almost symptom free. Only she got recurrence actually happened around when she came on 60th day. She said of some recurrence of the anal fissure symptoms. That is after she has gone for a wedding function or something. She has taken from outside, and some intolerant food she had taken, and then that symptom recurred. But even though her wheezing and allergic symptom didn't reappear actually. Then when we consider what are the changes in the body parameters, actually her weight was 67.5%, came down on 8th day itself to 66.3, and 15th day 65.2, and 30th day 63.9, and 60th day is 59, and day 90 it was 56. So it is coming down gradually. And BMI initial 25.7 to 90th day 21.5. Then BP first day after 8th day onwards it is normal. And abdominal circumference 90 centimeters to 78 centimeters in 90 days. And body is 63 to 52. So actually she is her real age is 53, and she was 10 years elder or accelerated age, and now it is come down below her age 1 by 1, 53 to actually now she is only 52 years her body age. And the fat percentage 39.2 was there and reduced to 32.2%. So it is actually the whole body has changed, and it is at a gross level and in the micro level also. Actually, that is what we are trying to change the fat content to, and the lean mass fat mass ratio to be optimized, and also to the cell level the omega 3/6 ratio to be optimized, because the omega 3 and 6 is the controlling the inflammation and anti-inflammation, controlling the immunity in effect. So that is what we are trying to correct during this clinically supported lifestyle correction. When we summarize this benefits of this clinically supported lifestyle correction for this patient, she is symptom free for 15 days and medication free by 16 days for the allergy, cough, and autoimmune problems, and also the BP also. Her BP, when we summarize what is the benefit she gained by this clinically supported lifestyle correction, she's for a long time she's suffering from this asthma, allergy, and also taking medication for recurrent respiratory infection and BP. She is symptom free by 15 days actually, and also medication free. Already whatever medicines she was taking, she is, even the inhaler and the cough syrup and the BP medicines, she is able to take overcome without avoid the medicine itself. She is able to make her symptom free. And when we come to the body parameters, BP was actually 150, 100 with the medicine, and now without medicine it is 120, 80, 110, 70 and all. And it is achieved within 15 days itself, and she is able to maintain it also. Next, for the weight change, when everyone want to be a trim and a fit body and all, no? Especially old, when we get old, we lose the shape. When we come to the body weight, she is able to reduce almost 11.5 kg, that is 67.5 to 59 in 90 days. And her abdominal circumference, she is able to reduce from 90 to 78 centimeters actually. And that is almost 12 centimeters reduction is there. When we consider about the accelerated aging, she was 10-year, body was older than real her calendar age. And that is, she was 53 years, but starting she was 63 years. And by 90 days, she's come down, she was able to come down by 11 years, 90 days. That is, she is actually 1 year younger than her real age, that is 53. Now she is only 52. So overall, the person actually, the whole thing is changing actually. With the in the clinically supported lifestyle correction, it is the body weight, body parameters, the blood results, everything actually getting changed, and the patient feel they become more younger also. Then next is, what is the future? What we'll do in the future actually? Actually, by 180 days in the clinically supported lifestyle correction, first initial 30 days is the time to get over the medicines mainly, and next again the 90 days is the one landmark, and next is the 180 days landmark. 180 days for this patient and all, we can come to optimal levels, and that is actually we're expecting her to come down to 52 kg by 180 days. So for her it is actually keeping between 50 to 55 is ideal. Always keep to the lower normal. That is for the aged. When you are aging, your body lean mass is reducing and fat mass is increasing. The muscle, you won't be able to increase that fast in old age. So reducing the fat is the practical side actually. Now, rather than, we can increase the muscle, but it is only a comparatively less quantity compared to reduction in the fat actually. And BMI around 20, keep the BMI. And blood pressure definitely around 120/80 they have to maintain. And abdominal circumference around 70. It's ideal for her will be around 65, but at this age, if you are not able to go to ideal level, it is okay. Between around 70 to 75 will be okay for her. And body age, if she tries, she will be able to come down to around 50 years of body age. According to that, it is actually lean mass fat mass ratio and the muscle ratio. It's a calculation actually. It's using electrical impedance mechanism is what we are using. That is cheap and economical, and it can be any time. There's no side effects. The exact lean mass fat mass ratio calculation and is also is possible with the DEXA machine, that is radiation and X-ray radiation and all come. So we don't use it. We would use only 8-lead electrical impedance mechanism for calculating this. And then this what she should take care of in the future is, once the body is reached the normal or balanced, then keep that body weight has to be maintained, and also at a gross level the body weight and lean mass fat mass ratio to be maintained. That is, you should not increase the fat mass more than, it's ideal for a lady is around 25%. At least they had to keep it below, because she was around 40. Now if she's able to keep the below 30 will be fine for her. Because she's allergic and she's having autoimmune disease, she should avoid the allergic and intolerant food also she should avoid. And also she should reduce the cosmetics and body application with these lotions and all to the minimum. But as a part of the clinically supported lifestyle correction, there is special body care oil and skincare oil is there. That itself will meet all the needs of the cosmetic aspect. If someone is needing for a special function, children, daughter's wedding or a special wedding, that occasion they can you can use some cosmetics and all, but immediately after that wash it off and apply this body care lotion, body care things which is given for the skin care. Here in clinically supervised and supported lifestyle correction, what we are trying to do is use the healing power of the body by empowering the healing aspect, the anti-inflammatory aspect of the immune system. First is by providing optimal nutrition. Second, by promoting removal of toxins by improving circulation through optimal stimulation of all cells by planned exercise. Third, minimizing toxins entering the body through food, water, air, and cosmetics. Diabetes, hypertension, heart disease, liver disease, kidney disease, obesity, stroke, allergies, autoimmune diseases, and cancer come under the umbrella of lifestyle diseases. 90% of the medications and 90% of the surgeries are for lifestyle diseases. This means that 90% of the medicines and 90% of surgeries can be avoided. In the case of any lifestyle disease, the best treatment begins with the first step of diagnosing the underlying fault in lifestyle that is the cause of the disease. Next is corrective measures to rectify the damage and overcome both the disease and the need for continued medications and surgical interventions. It is good to understand that neither medicines nor surgery can cure a lifestyle disease. To put it differently, it is not a lack of medication or surgery that created the disease in the first place. This is why once medication is started, it becomes a partner of the disease for life. Very often, both the disease and medicines will keep on adding more numbers along with the unwanted side effects, with no hope to return to a healthy status, which not only affects the patient but also the dependents and caretakers. This is why it is very important for you to understand and correct lifestyle while also encouraging others to do so. Another important aspect is when someone is talking about healthcare and treatment approaches, you should consider the scientific background of the concerned person. I am Dr. Jolly Thomson, started medical education in Government Medical College, Kottayam as 1981 batch and completed diploma and MD in obstetrics and gynecology from Government Medical College, Thiruvananthapuram, Kerala, India in 1992. After additional training in reproductive medicine, surgery and painless labor, I joined government service. Later, I resigned from government service and in 1997 started practicing as consultant at Life Care Center, Tevara, Kochi. I focus on lifestyle modulation with the clinical support for lifestyle diseases, minimizing need for medication and surgery. We believe the informed patient is the key to treatment success. You can find detailed content on different diseases, their treatments with emphasis to the benefits of lifestyle correction from website and YouTube playlists. The videos are prepared to understand more about the disease, the possible underlying cause, early diagnosis by understanding symptoms, current diagnostic methods and treatments along with the benefits and side effects, practical aspect of lifestyle self-correction and for those who may require clinically supported and supervised lifestyle correction. When a patient is having more than one disease and there are too many diagnostic and treatment modalities with many side effects, awareness of the benefits and problems of different diagnostic, medical and surgical interventions is the key to regain your health. Better informed patients take better decisions and live longer, healthier, happier lives. I would like to bring to your attention how the major part of the medications we take are excreted in urine, sweat and stool. It will reach the groundwater, rivers, drinking water, plants, animals and food products. That means the medication we take is becoming a threat not only to us humans but to all the life forms on our planet. Therefore, it is essential to correct lifestyle, reverse lifestyle diseases and come out of medications. To protect your children, grandchildren and the coming generations from the ill effect of toxic pharmaceutical pollution, we should come out of the dependence on medication. The current norm of chronic patients on lifelong medication has to change. Spreading awareness on optimizing and minimizing medication is the need of the hour. Thank you.